Hi, we're Hannah, Jenny, and Hannah, three medical students at Temple University. Today we're working with PHA Cares to talk to our community about the COVID vaccines. We know that this topic can bring up a lot of conflicting emotions: excitement that life may one day return to normal, and fear of a new vaccine that was developed with unprecedented speed. Above is a quote by Dr. Kizzmekia Corbett, one of the lead scientists on the National Institute of Health's COVID vaccine research team. When asked what she would tell people who are nervous about getting a COVID vaccine, she said that she would say, "You've earned the right to ask the questions that you have around these vaccines and the vaccine development process. Trust, especially when it has been stripped from people, has to be rebuilt in a brick-by-brick fashion. We agree that you have the right to know how the COVID vaccine was made and how it works before making a decision about getting it." We're excited that you're joining us today, and we hope that we can answer some of your questions. There are two big reasons to get the COVID vaccine. The first is to protect your own health. You may have heard that both the Pfizer and the Moderna vaccines are 95% effective at preventing infection with COVID. But if you are one of the unlucky few people who do get COVID after being vaccinated, the shot will also prevent you from getting extremely sick. Of the 32,000 people who received a Pfizer or Moderna vaccine in clinical trials, only one trial participant got hospitalized with severe COVID and no participants died. The second reason to get a COVID vaccine is to protect other people in your community. We are still collecting data on how vaccination affects transmission, but we think that if you are exposed to the virus, the COVID vaccine, like other vaccines, will prevent you from spreading COVID to your loved ones. We are also hoping that once people get vaccinated, fewer people will get hospitalized with COVID, hospitals will become less crowded, and it will be easier for healthcare workers to take care of people in our community who are sick with other illnesses.
There are many benefits of vaccination. Getting a COVID vaccine will help keep you from getting sick with COVID-19. In 2020, COVID-19 was the third leading cause of death in the United States, behind heart disease and cancer. Given the high disease burden and mortality rate for COVID-19, vaccines are an important and safe way to build protection for yourself and put an end to the pandemic by protecting those around you. If more people are vaccinated, there will be fewer COVID-19 infections due to a concept called herd immunity. Herd immunity is a form of indirect protection that occurs when the spread of a disease from person to person within a population is decreased due to the immunity built through vaccination. Overall, vaccines have allowed us to manage other serious diseases in the past, such as polio and smallpox, and the hope is that the COVID-19 vaccines will have the same impact.
You may have heard that the COVID vaccines don't offer immediate protection. It takes some time for your body to learn how to recognize and fight the COVID-19 virus. The day you get your first shot, you won't be ready to party like it's 2019, but you'll be well on your way towards having protection from the virus. If you get the Pfizer or the Moderna vaccine, you can expect to have some immunity 10 to 14 days after your first shot, and you will have full immunity either 7 days after your second Pfizer shot or 14 days after your second Moderna shot. When you schedule your second shot, you should mark this date on your calendar and find a safe way to celebrate. Once you're vaccinated, you will still have to wear masks in public places and avoid big crowds until everybody in our community has had a chance to receive their COVID vaccine. Once you're fully vaccinated, you may feel safer doing things like grocery shopping in person, sharing a meal with a few close friends, or hugging your grandchildren.
So how do the vaccines work? The two most popular vaccines right now, the Pfizer and the Moderna vaccines, are mRNA vaccines. This stands for messenger ribonucleic acid vaccines. mRNA serves as a set of instructions for the body to produce a protein that is found on the surface of the virus. To be clear, the vaccine does not contain any components of the virus itself. It is only mRNA, salts, sugars, and fats to help preserve and let the mRNA enter cells where it can be read. First, scientists identified the sequence of the virus's genetic code that corresponds to a particular spike protein. They then use that sequence to create mRNA in a lab that then gets injected into the person receiving the vaccine. Once it enters the cells, the body produces the spike protein, and the immune system gets activated to produce antibodies and triggers T cells to destroy cells with the spike protein. This builds memory, so if the person later catches COVID, the antibodies and T cells will already be primed and ready to attack those cells before the virus can replicate and make them sick. The vaccine is pretty awesome, but it can come with some side effects that may feel like the flu, but should go away in a few days. On the side where you get the Fauci ouchie, you can experience some pain, swelling, or soreness. Throughout your body, you may feel tiredness, fevers, chills, or a headache. In order to reduce the side effects, you can take some ibuprofen or acetaminophen, drink lots of fluid, avoid pressure at the site, and use your arm. It sounds counterintuitive, but exercising made me feel much less sore and achy. That being said, call your doctor if you are worried, the redness or tenderness where you got the shot increases, or your side effects do not stop after a few days. Unless a provider tells you not to, you should still get both shots, even if you experience side effects. There is an application called vSafe where you can tell the CDC about any side effects that you experience from the vaccine, and they'll send you reminders for your second dose as well. You can download it at www.cdc.gov/VSAFE.
The goal is for everyone to be able to easily get a COVID-19 vaccine as soon as enough vaccines are available. The vaccine supply will increase over time, and other vaccines are still being developed and tested in the meantime. Until there are enough vaccines for everyone, the distribution is being conducted in phases. The initial phases allow people who are most at risk of getting COVID-19 or having serious complications from the virus to get vaccinated first. This includes frontline healthcare workers, people who are 65 or older, and people with certain medical conditions such as diabetes or kidney disease. With time, the phases will become more broad to allow more people to get vaccinated as the supply increases. Each state has its own plan for vaccine distribution based on recommendations from the Centers for Disease Control and Prevention. Pennsylvania is currently in Phase 1A of distribution. This phase includes long-term care facility residents, healthcare personnel, and other clinical personnel in school settings or correctional facilities. The next phase, Phase 1B, will include people 75 years and older, people in congregate settings, people receiving home and community-based services, education workers, individuals caring for children or adults in day programs, and several other groups. Although we cannot predict when Pennsylvania will move to the next phase of distribution, information about any updates and who is included in each phase can be found on the Pennsylvania Department of Health website. There are many questions surrounding the COVID-19 vaccines, and we would like to address some of the most common concerns. You may wonder whether the vaccine can give you COVID-19. They cannot. While some vaccines are made with live but weakened viruses, both the Pfizer and Moderna COVID-19 vaccines are made with mRNA that codes for a spike protein, not the virus itself. No virus is used to make the COVID-19 vaccines, so it is not possible for the shot to give you COVID-19 or cause you to have a positive COVID-19 test. Some people are surprised at how quickly the vaccines were developed and are concerned about their safety. The quick development is a result of people all over the world working towards a single effort to fight COVID-19. Because of the scope of the pandemic, a ton of money, resources, and research were dedicated towards the development of a COVID-19 vaccine. Furthermore, the research behind other types of coronaviruses was done prior to the pandemic after previous outbreaks of the SARS and MERS coronaviruses, so there was already a foundation to build on for vaccine development. Although mRNA vaccines are new, they are not unknown and have been studied before for diseases such as the flu and rabies. The COVID-19 vaccines have been held to the same rigorous safety standards as all other vaccines and have had to pass through an extensive clinical trial process to gain approval, so they are extremely safe. Furthermore, because the vaccines are made with mRNA, they cannot alter your DNA, which is a different type of genetic material. Another area of concern is surrounding the cost of COVID-19 shots. The vaccines that are being distributed have already been paid for by the government. While some vaccine distributors may bill insurance for administering the shot, if you don't have insurance, this fee will be paid for by the CARES Act Provider Relief Fund. Thus, you can still receive a vaccine even if you cannot pay for the administration cost.